we give the word to Professor Alexandra Marmuranu, Patient-Centered Care, Informed Consent, and Shared Decision-Making. Please, Professor.
First of all, I'd like to thank the organizer for inviting me, being here today. Dr. Grigore Tinica and everybody else, it's a great opportunity. I always enjoy coming back to Romania. Sorry about being late. If I look like I came down from the mountains, I did. This morning I was on Raro Chalet, it's Cabana Raro, it was snowing, I just want you to know. And on the way here, we got stopped by police for speeding, which they thought they were Americans coming from the Russian front, you know. So it took a little bit of a delay. I totally believe that a good talk is a short talk. We don't have that much time. I prepare what I think would be a very interesting talk. Why? Cardiac surgery, and I'm not sure if Frank will agree or disagree with me. You know, I train at New York University, and Frank Spencer used to say, one of the pioneers of cardiac surgery, when I first started, he says, well, that's how we do it here, every day the same way. And I said, no progress. It almost got me thrown out of the residency. But it's not much new stuff that happens in cardiac surgery. And Dr. Melicanti did an amazing job, molto bravissimo, mille grazie. Anche io, ciao. So did an amazing job explaining where we are today. There are certain issues, and there are certain things that we have to deal with it in the US. Now, I was born here, my parents were physicians, I went to school here. I'm not sure exactly the system, but let me tell you what we're going in US and what are the issues and some of the struggles that we're dealing in terms of administration. Years ago, I'm doing this for 30 years. Surgeon was the team captain, not anymore. It's the patient right now. So I think that there is a time right now where we can change the balance. I'm gonna try to make it in time, and I did put a few slides in the end for the students, for the residents, for the fellows, because being a surgeon is about taking care of patients, that's first, but it's also about having a balanced life, about doing the right thing for you and trying to improve the world, but also living your life. Everybody's asking me, how is it in America? So I put a few slides. Hopefully you have time to go through all of them. Trying to switch this thing. Am I doing something wrong here? Let's try this way. All right. Well, that's me in the operating room. Do you have a laser? All right, let's try this. So this is the okay sign. Things are going well at the end of the operation. It's not moving that well. You know, it's not working. Years ago, I gave a robotic talk, and I couldn't change the slides. And I was so embarrassed, I thought, how can I tell those guys about robotic technology if we can't even change the slides? Imagine what would happen in a surgical procedure. All right? Can you guys change it from there? We're still okay? All right, there you go. So, I was born in Govora. My parents were physicians. Went to school in Craiova. Did my residency in New York University, Mount Sinai. Did my cardiothoracic surgery fellowship at UCLA. Been on the faculty at NYU, UCLA. Now I'm assistant professor of surgery at California University of Science and Medicine. What am I doing? I'm the CEO of California Heart and Lung Surgery Medical Center, which is basically my company. I'm the chief of staff. What is that? I run the doctors, not the hospital. There are 1,000 physicians. This is the biggest private practice hospitals in Los Angeles, called Hollywood Presbyterian. I'm the chief of cardiothoracic surgery in 2 hospitals, Centinela and Southern California, chairman of MDPR, medical executive committee, And for a change, when I was here, I love to break the law, the rules. Now I'm making the rules as a bylaws committee. We're going to talk about informed consent, what we tell the patients. The patient is the team captain those days. So informed consent is a legal and ethical process requiring patients to receive adequate information to make informed consent decision about their medical care. Physicians have the responsibility to assess patient capacity. Basically, you got to figure out if this guy is able to consent. Check if he got it or not. Ensure decisions are made independently. When I was in Romania, families were saying, hey, don't tell me that he's got cancer. Don't tell me. He doesn't want to know. We don't want him to know. Well, that's wrong. We cannot do this in the U.S. I don't know what's going on here, but that's the way we practice. So, communication is key. Got to tell them about the diagnosis, patient condition, implication of surgery, urgency of the diagnosis, explain the nature, the purpose of the intervention, how the procedure addresses his needs, use visual aids as necessary, clearly provide a detailed explanation of surgical procedures. Most important, risk, benefits, and alternatives, including non-management, including, listen, I don't have to do this case. If you ask me, if you're not 100% sure, just don't do it. Because they will come around. If there is a complication, chances are you're going to get sued in the U.S. So you have to document all the potential complication, recovery time, quality of life. Very important. We talk about cardiologists, we talk about cardiac surgeons. It's mandatory to present all the options, including non-surgical treatment and the option to forego intervention if appropriate. Listen, you don't need to do your heart. It's a non-STEMI. I think you should have surgery. You don't want to do it, go home, think about it. Okay? Very important. Don't push them. That's the way I want you to do it. That doesn't exist. Got to document. Got to document, again, medical record entry. Document the patient or the surrogate decision clearly, a note in the patient chart regarding all the treatment options. You have to document the details of the conversation, document the consent. Shared decision making. Like I said, they are in charge. Why is this important? Promotes patient autonomy, respects their choices, and clearly improves their satisfaction. Improve trust, clear communication, open dialogue, improves results, improves pretty much, they've done studies, improves pretty much everything that's related to the recovery stage. You gotta try to reduce your legal, ethical liability, the risk mitigation, legal protection, clearly ethical compliance. Where are we going? You want the patient to participate in your decision. You help your patient explore, compare treatment options. I can do a Lima to LADF pump. The cardiologist can put a few stents. I can do 5 grafts on bypass. I can do it off pump. I can do it robotic, or I cannot do it at all. Or perhaps shouldn't be done. I can do TMR or not. Explain them. Get to understand their patient's values and preferences. Just because we think is right. I personally do cardiac surgery. I do thoracic surgery, lung resection, surgical oncology. I do vascular surgery. Segmentectomy, got a 2-centimeter lesion. Should I do a segmentectomy? Should I do a lobe? Should I do a wedge? You got to talk to the patient. You know, it's not one size fits all anymore. Reach a decision with your patient. Decide together on the best option. Evaluate your patient decision. Is this reasonable? Any concern? Document. Be sure he will be in charge. Why? Because he will suffer the consequences of that decision. You know. Requirements to obtain surgical consent during emergencies. I'm not sure how it's in Romania those days, but what we need to look at obviously patient well-being and autonomy within the emergency constraints. You gotta look at rules, regulation, policies, and procedure and bylaws in the hospital to be sure that you are doing the right thing in regards to following the rules. Patient capacity, STEMI. You guys know what STEMI is, I'm sure. Basically, this guy needs to go to DOR, might be a left main, perhaps 95 years old, low ejection fraction, perhaps should have a stent. Not everybody needs to have surgery before they die. That's very important to know that. So, determine patient capability to make informed decisions, identify surrogates, check for available and legally authorized representative. If not, use your judgment. Key principles. We gotta address the patient as a whole, individual, beyond their symptoms or diagnosis. Active listening, show empathy. It's all about collaboration between patient and the healthcare team. And again, patient-centered care is a healthcare approach that prioritizes the needs and preferences of the patient, ensuring their active involvement in all aspects of the care. Patient-centered care encompasses qualities of compassion, empathy, and responsiveness to needs, values, expressed preferences of the individual patients. So like I said, you don't have their guidelines. There is a standard of care. If a patient wants to do it somewhat different, not 180 degrees different, you got to work with them. The benefits, again, of patient-centered care: enhanced recovery, we spoke about it, trust and compliance, building strong patient relationship increases trust and adherence to treatment protocols, rules, regulation, policy, and procedure, and last but not least, optimize surgical outcome with active patient engagement, which leads to better pre-op and post-op management. Use plain language. Don't try to be fancy and pompous. Explain them what's going on. Simplify, at least try to simplify the medical terminology. Employ everyday analogies. Teaching aids. Arteries are like highways for blood flow. I always try to talk to them about the highways around Los Angeles. They seem to understand that. Perhaps use teach-back methods. Verify the patient is clearly understanding what you're telling, and use the learn model. Learn, listen, explain, acknowledge, recommend treatment, and very important, negotiate treatment. Now, that's not a negotiation on a Sunday fair. Tell them what you think. Make your recommendation, and then talk to them again. You want it on pump, you want it off pump, we can do it this way, you can do it the other way. Lung resection, we can do a lobe, we can do a segment. That's the recurrence rate. I think a segment is better for you because your PFTs are not that good. We can try to do a stent for your AAA, might not work out because it's very close to your renals, there is not enough neck, and so on. Benefits of patient-centered care. Again, increase patient compliance. They tend to work with you. Enhance communication and education. Improve the outcomes. Active patient engagement leads to better physical recovery and mental well-being, with what's important for us, probably for you too here, higher patient satisfaction scores. They all Google you, they look how many stars you have on Healthgrade, they all look at your reviews, they all look at the hospital reviews. If your hospital is 1 or 2, I practice in 6 hospitals, actually 7 now in Los Angeles. So patients come to me, they say, well, I want to be done in this hospital, I want to be done in that hospital. And his insurance pays for this hospital. And then the whole dance starts, and you're not paid for that. So basically the negotiation part starts. You got to promise them that you're going to do them in the best place for them. Perhaps the cardiac team is not the best in that hospital. It's always a dance. You got to dance with this. Patients feel valued, enhancing their overall experience while you listen to them. Enhancements, important, they enhance patient safety and decrease the likelihood for litigation. We're talking about lawyers getting involved and so on. Positive communication and documentation strengthens the trust in the relation between patients and physicians, clearly minimizes the misunderstandings and the risk of malpractice. You might, I don't know how it's here right now, but if you get sued, and I've been sued, don't have much time here, let me tell you quick. I've done a mitral valve, I've been sued that I closed the circumflex artery. We cast the patient, the circumflex artery was open. The lawsuit lasted 4 years. He finally got thrown out because the artery is open. and they are appealing. In the meantime, my insurance went up, I'm malpractice, and that's what we have to deal. That's the meaning for this talk. Conclusion, informed consent and shared decision-making are essential aspects of patient-centered care, promoting patient autonomy and high-quality healthcare. Gotta collaborate, patient, physician. Patients have the right to be informed. Again, they become the team captain. Physicians, we have a guiding role, not anymore, we're not bosses anymore. Perhaps it's been a long time ago. And in the end, that's the take-home message. The adult patient, the competent adult patient who ultimately experiences the outcome of any medical intervention should have the final say in their treatment decision. TAVI or not, stent or not, open or not, and so on. Some of the references, I want to take 1 more minute for the residents and fellows. You guys work hard. You gotta try to live for them, do a good job for the patients, and try to live your life. So everybody asks me what's going on. That's Melicanti Extravaganza. It's called the Mille Miglia. Dr. Melicanti can tell you. We do a lot of charities. Seinfeld, Champagne, for our patients who raise money. DiCaprio, Djokovic, I used to play tennis here on the national team, so I still continue. We do hang out with the Kardashians from time to time. Jack Nicholson, Bill Gates. Obviously, it's my girlfriend and my daughter. Those are not movie stars. Race all cars. That's my daughter graduating here. As you see, I adopted the medical and American lifestyle, being a surgeon on their special forces. That's an Uzi there. And we do hostage rescue situation, ski, windsurf, race cars, obviously. And thank you. Any questions?
Any questions?
Which car was in the Mille?
I thought you were going to ask this. I was hoping for that. Mille Miglia is a fantastic race. It's called the most beautiful race in the world. I actually own 3 race teams, and I race my cars in all of them. I owe them because, you know, I want to be the boss at least with my race cars, if not with the patients. I raced a 1947 Fiat Stella Alpina owned by the Beretta family, by Ugo Beretta, which actually the car won Mille Miglia in '49. That's a vintage race, fantastic.